Our next speaker is Dr. Andy Anderson, who is the CEO of the RW.Barnabas HEALTH Medical Group. His CV is in the material, but Andy has been a wonderful partner from Barnabas Health from ever since I got here, ever since he got here. He came here shortly after I did. Has been a wonderful partner in building this initiative, in collaborating on so many different projects with us, and then never said no to us despite how busy he is. So Andy, we're so thrilled you'll be with us today. And Oliver, if you can pull up Andy's slide deck.
Thank you, and thank you for providing this forum and for advancing the conversation around practice-based research, which is critically important as we think about the future of healthcare in New Jersey and beyond. So I'm going to spend time providing some overview of our health system, RWJBarnabas, the partnership between the health system and the university, Rutgers, and the medical group, which I lead, and really expressing the opportunity for practice-based research, given the magnitude of resources, of practice sites, of patients that we're caring for. My biggest message is the magnitude is enormous of opportunity, and we've started to move forward on some of those opportunities, but I think if we really can pull ourselves together and partner and collaborate even more deeply, we're going to be able to accomplish a lot. And that's going to translate into better health for our populations and for our individual patients. And it's going to be noted on a national scale. So this first slide has the word health highlighted purposefully. I think we've already spent time, and Dr. Elnahal did as well, talking about the vital importance of health and moving away from health care to really focusing much more on health. The next slide will give you a sense for the RWJBarnabas Health System in terms of its mission and vision. You'll see in the vision statement, healthy communities is those are the words. And then in the mission, the words research, clinical and social determinants of health, they're right there front and center. These are the things we're talking about. These are the things that we need to do better on as institutions in terms of delivering outcomes for our patients in our communities. The next slide is the overarching sort of magnitude of business, if you will, in terms of the scope. The health system is covering almost 2/3 of our state. A lot of volume in terms of hospital care, emergency room care, a lot of outpatient visits. You'll see at the bottom left, 2 million outpatient visits. That's a lot of patients that are being touched. A lot of opportunity again for practice-based research. The assets, if you will, to coordinate, integrate care for our patients are all there, whether it's an acute care hospital and children's hospitals, behavioral health, medical group, pharmacy services, radiology services. It's all here. It's a matter of getting it really integrated and coordinated and optimized, with the patient at the center, which is going to lead us down the right path to the future. I'll point out in the bottom right, the social impact, community engagement is a fundamental, critical part of what we're all trying to do. The next slide is specifically about the partnership between the health system and the university and the vision here. A master affiliation agreement was signed between Rutgers and RWJBarnabas back in July of 2018, which is a 20-year agreement, signaling the commitment for that partnership over a long time frame. And the pillars of that partnership are listed here: patient care, research, and education. And so again, to bring this back to practice-based research, I think the opportunity is front and center. It's part of the vision of the partnership, is something that we need to capitalize on. The next slide is an overview of the medical group. This is the part of the health system and the university that I'm leading, and bringing this together into one medical group is how I like to think about it. we don't really even have a permanent name. The name at the top is I call it the holding pattern name. Rutgers-RWJBarnabas Medical Group is meant to be inclusive and really bringing together what historically has been separate, functioning groups of physicians. I put in darker color here the components of this that are truly integrated at this point financially and operationally. The physician enterprise, which was the RWJ Historic Medical Group, Barnabas Health Medical Group, RWJ Medical School, Robert Johnson Medical School, and then UPA, which provides services for New Jersey Medical School. Those four entities are all integrated financially, operationally at this point. The plan is for these other entities to continue to come together to create a single medical group, which will provide a platform for practice-based research. It'll be easier to coordinate across this whole enterprise. At the bottom of the slide gives you some of the overarching connecting pieces. A really important one there is Epic. Epic will be the electronic health record across our entire medical group and across our entire health system and all of our hospitals. We just went live a few days ago, actually, with the first wave of Epic and a subset of our practices. There'll be another go live in early October with the rest of our medical group practices, as well as one of our hospitals. And then in 2022, 2023, all of our hospitals will go live on Epic. This will be critical in terms of practice-based research to have that single platform to be able to do that work. Even more critical for me is the patient portal. It's the way that we're going to make sure we have one medication list, one medical record, one problem list. We're really centering and coordinating around the patients through that single platform. The other pieces at the bottom that I want to highlight are the service lines and thinking about, how do we best coordinate services such as primary care access across all these different hospitals and practice sites. We've made a lot of progress there. Have made a lot of progress with cancer and neurosurgery and behavioral health and some of our other service lines to truly have a standard clinical model, a standard model of how we provide access for patients. And again, it's a great forum for us to do practice-based research within these service line offerings across a large integrated health system and integrated medical group. The next slide is the medical group mission and vision. Again, calling your attention to the mission with the academic environment, patient-centeredness, and healthy communities being what we want to make sure we're doing. The vision, physician-led academic medical group, and trying to be the very best we can be, the place where our doctors and staff want to work and the place where our patients want to come for their care. The next slide is centering on what I would call practice-based outcomes. And these are the areas that we should be studying. And we should be developing best practices, and we should be developing standardized workflows to make sure that our outcomes are of the highest quality, the highest safety. Do we have the access that we think we have? Are we coordinating and integrating care around the patient with the patient truly at the center? Are our providers and staff engaged? Are we lowering costs of healthcare? Are we hitting on our education mission outcomes? Health, equity, diversity, inclusion, a critical lens for us to really understand, what is our current state, looking at data and trying to close gaps, trying to address areas that we know we can improve on, that we have discrepancies, where there are real issues here that we can work on. Cultural competency, health literacy, a whole nother field of opportunity in terms of practice-based research. So these are the outcomes that we have established for our group. These all, in many ways, fit with practice-based research and understanding, what is the best approach, what truly works, what is the best evidence, and how do we influence behavior, how do we create an environment where our staff and our doctors and others are delivering these outcomes in the best possible way. Next slide gives you a sense of the magnitude of opportunity. I showed you earlier 2 million visits, 1.1 million of those are in the health system medical group practices. The other visits are in other pieces of the health system and across our Rutgers practices. Again, a lot of opportunity. Telemedicine is another forum with COVID that has emerged We had our 130,000 telemedicine visits last year. So a lot of volume here in terms of being able to study and understand what's working and what's not working. Next slide is the thinking that I hope we all have about moving from what has been historically a sort of hospital-based system to an integrated health system. And I think of this as having primary care at the center, and then having specialists and other services around that, and what I call medical neighborhoods that are based in our communities. And the next slide gives you a sense of all those different potential services that are oriented around our patient, around our primary care, whether it's a surgery center or radiology services or specialist service or laboratory services, truly trying to build this in a way that's coordinated and integrated. And again, back to the point of, do we truly know what works best, and can we study this through our practice-based network? And we absolutely can, and we should. Next slide goes to the point that Dr. Elnahal was making about the social determinants of health, and the fact that our healthcare services are a very small part of keeping people healthy. And so having more opportunities to really look at, through data, through focus groups, through engagement with our communities, what are those socioeconomic factors that we can help influence as a healthcare system, as healthcare providers. The healthy behaviors is a whole nother area that, as a physician, I remember from my training not having much training around motivational interviewing, around how to truly talk to patients, spend time with patients, and understand how we can best influence behaviors. And it just doesn't all have to be the doctor. This is the team-based approach where you truly can have a team surrounding the patient, whether it's a social worker or a pharmacist or a nutritionist, to help with coaching, to help with diet, to help with access to services, whether it's food or shelter, and many other pieces of a person's environment that really can be helped through coordination. And health systems need to take more accountability, more responsibility in this area. And we need to, again, study it to understand what are the most important factors, and how can we drive them forward, and how do we address our communities in the best possible way. Next slide is around our clinical delivery of population health. The health system has partnered with an organization called NAVIS to truly look at our opportunities in value-based care and manage lives through our contracts with our payers, such as Horizon, or through Medicare, MSSP, Medicaid, to really get to a better spot for delivery of healthcare and for promoting health. And so these statements here are, I think, relatively bold statements that we want to aspire to, that we want to be a nationally recognized value-based healthcare organization. We want to advance value as defined by these parameters, which I've been talking about, such as access, the experience, the quality of the outcomes, the affordability, the cost of it, and then making sure that it's safe and making sure it's equitable. And so transitioning as a health system, as a medical group, from a fee-for-service environment to a truly value-based environment that has the right outcomes for our patients and our communities. Next slide comes back to my point about the opportunities. That's why it's underlined, are enormous. We have to spend more time doing this work together. The next slide gives you some examples of some of the proposals and letters that I personally have signed to promote, to say, this is the type of work we need to be doing in our practices, and really trying to encourage our physicians, encourage our practices, encourage our health system and university to actively participate in these opportunities, because I do believe it's going to translate into evidence-based care pathways and ways to deliver better services for our patients and our communities. The next slide brings us back to the patient. This is my last slide, and the importance of taking care of the patient in front of you, knowing that each patient is going to be different in terms of whether it's their genetic background or their environmental background. And the question always is, how does this apply to my patient? When you look at the evidence, which we all should be doing, how do we best apply this to my patient who's in front of me. I think that's going to be critical. If we can have all of our patients be healthier, then our communities are going to be healthier, and we're all going to be successful when that happens. So thank you for the opportunity to present today. Happy to take a question or two if there's time.
Sure. Thank you, Andy, so much. And if anyone has questions, feel free to raise your hand or type into the text. While that's happening, I just want to reiterate, Andy, it's been a wonderful partnership working with Barnabas Health, and ranging from the Data Governance Committee with Bob Irwin, Dave Arnold, and many of the folks, to our work with Joe Yeager, who's on the call with us today, to the work with Jesse Israel, through Geriatric Palliative Care, to our work with Sue Wong from Center for Aging Health. You've been a wonderful partner. We really appreciate it so much. If I don't, Steve, yes, go ahead.
Yeah, Andy, excellent presentation overview. Tell us a little bit how you're addressing the issue of the culture. So a lot of different hospitals, a lot of different history and backgrounds of the different institutions, the legacy Barnabas side, the legacy Robert Wood side. So maybe you can talk a little bit about that.
Yeah, I think that's part of the challenge that we all face is, history, culture, doing things a certain way for many years. It's difficult for change to happen. For me, I always try to start with mission, vision, values, or purpose, and continuing to remind people about that, and then putting the patient at the center, and understanding these are the outcomes that we all together want to achieve. Practically speaking, some of this is going to be just better alignment of incentives and having us think more as a system rather than as an individual entity, whether it's an individual practice site or an individual hospital, and trying to have everyone think more as a system of care around the patient. So I do think we've made a lot of progress there, but still a lot of work culturally to do over time to get us to the right spot.
Great. Thank you so much, Andy, again, for spending time with us. We truly appreciate it so much.
Thank you.